having a bit of good news, I suppose, in the case numbers seem to have dropped off in the Albury region. And so in Murrumbidgee overall, we only had 14 cases notified to us in the last 24 hours. 10 of those were Albury, 1 in Federation, 1 in Temora and 1 in Wagga. Now that's great news, but I will have to also say that the testing numbers seem to have decreased. So let's hope it's true. There's no additional cases in our community, but we'll encourage people with any symptoms at all to get tested, because we do know there is COVID around, and we don't want undiagnosed infectious people spreading it to increase our case numbers. The isolation requirements for positive cases have changed over this week, and so if you're fully vaccinated and you happen to get a breakthrough infection of COVID, after 10 days, if you're well, you can be released from isolation. If you're unvaccinated, you still need to stay in isolation for the 14 days, and when you're well at the end, then you can be released from isolation. If people have ongoing symptoms, though, they are asked to stay in isolation and they won't be medically released. From Monday, New South Wales Health no longer publishes venues on their webpage. And so that's just a new way of doing. We still follow up venues, or not all venues, however. We follow up high-risk venues, as the Public Health and New South Wales Health will follow those up, but they no longer put the general venues on the web page. We still have our vaccination rates in Murrumbidgee are quite good. Our first dose for overall vaccination rate is 97.3% on Monday, and that's really awesome. And even more awesome is the 2 doses is 90.5%. So that's fantastic, and a credit to the Albury population and Murrumbidgee population. That's Murrumbidgee data, sorry. It's a credit to the population and to the vaccinators who have been vigilant in getting everyone vaccinated. There is still obviously numbers of people who are not vaccinated, and vaccines are available throughout the district in an ongoing way now, and encourage you to get your vaccinations. Booster shots are now available also for people who were vaccinated over 6 months ago. So if you had your course over 6 months ago, please go in for a booster shot. The booster shots have shown to boost your immunity incredibly, and there have been really good outcomes for people who have had those booster shots. So that's something that we encourage you to do. Any questions?
Why did the isolation requirements change for vaccinated versus unvaccinated?
Well, they have believed that the studies, the CDNA released those recommendations, and they come off the back of understanding how infectious people were. So people who have been vaccinated who do get the infection, towards the end are less infectious than people who are unvaccinated, and that's why it's changed.
So they sort of think that towards the end of your infectious period, if you are double vaccinated, there's like a significantly lower chance of passing it on to somebody else?
Oh, absolutely, yeah. They wouldn't be releasing anyone who they felt was still infectious. So by day 10, if you're asymptomatic, they don't believe that you're infectious.
And potentially could be still infectious if you're displaying those symptoms. Is that why they're asking?
Yeah, so people who continue to have symptoms, and particularly immunocompromised people may have symptoms, those people, they're concerned, and evidence has shown that their body has not been able to eliminate the virus, and so potentially they can be still infectious, yes.
And those 10 cases in Albury today, are they household contacts, or we know where they got them from?
The cases in Albury today are linked to other cases, so we are able to detect where they came from, yes.
And obviously, like we're saying, it's really important that people still get tested, because we want to find out if there is any more cases, so we can make sure that there is no more later flare-ups of COVID in Albury. Could you kind of just reiterate that in the sense of like, I guess, how many people need to get tested? Is there a number, or?
Look, there isn't. It boils down to if the positive people get tested, there's no other people that need to be tested. But of course, we don't know who those positive people are. And of course, people who have symptoms that may not be COVID, they don't know it's not COVID until they're tested and it's ruled out. So it is really important that anyone with any respiratory cold-like symptoms, or even hay fever symptoms, recommend that you get a test to ensure or to be confident that it isn't COVID, or if it is, then you can isolate appropriately. What we are finding out in recent times is a number of people who do test positive actually have had their symptoms for a few days, and that means for those few days they're in the community infectious. And so we want people to have symptoms, A, to isolate, but also get tested very quickly from the onset of those symptoms, rather than leaving it a few days and going, well, I'm not getting any better, I might go and get tested. Try and get tested straight away. It's really important.
Just on the positive cases that we've got, have any of them been from the rats testing and been directed on to getting a PCR test?
Yes, so to date we have had no positive rats that are in the schools you're particularly talking about. So we've had no positive rats in the schools that we've been made aware of that people have subsequently come in for testing. So that's encouraging too. And feedback from the schools community is that where the trials have occurred and surveillance has occurred in the schools, it has given both the teachers and the parents confidence to return to those schools. So they're more confident that there aren't the kids and teachers have been screened, so there should be less chance of being COVID in the schools. So that's more confidence for the children and the teachers to attend.
And those outbreaks there, are we relatively confident that they're under control and schools remaining open and all that sort of thing at the moment?
Yeah, schools do a really good risk assessment when there is a diagnosed case in the school, and subsequently those children or teachers are, if they're close contacts, are asked to isolate at home. That's been very successful to date, and we're still going to, of course, get new cases popping up in schools all the time. The schools are getting more and more experienced with dealing with that and being more efficient with just isolating the class at risk rather than the entire school, and keeping those schools open. So that's a credit to the schools and the education department.
And on the rat testing as well, I'm a little surprised that there hasn't been any non-negatives in RAT testing, considering that I think it was 2/3 of the people were under 20 with the virus. Are you surprised at that? And do you think it was just a case of the people who are actually using the tests just happened to be the people who didn't have them, or is there any other reason?
Look, it's difficult to comment on that. What I do believe is potentially those children in those schools may have been less infectious than perhaps in other communities adults might be infectious, but that's speculation, and therefore those other people in the contacts in the class may have been less likely to pick it up. Look, it is speculation. I can't really comment as to why.
Is it a chance that the RAT testing could have come too late, after all those infectious cases at schools had already been isolating at home, they'd already identified the close contacts and sent them to get the PCR test already?
Look, I think that it could be a mix of that. I really don't have a good rationale for why there haven't been any positive today.
It's obviously a Department of Education run program, but is there any indication of how successful it's been? I guess how many parents and families have been taking the RATS test?
Yeah, look, that is a Department of Education and it's a combination of health and education, and they'll have to do an analysis on that. My anecdotal understanding is that uptake has been quite good, particularly in the school that used as not as surveillance but as a way of getting the close contacts children back to school. So I understand that's been a real positive uptake, but there will be an outcome analysis done of that, and then a determination of where that should go from there.
When can we expect that? Do you know?
Look, I'm sorry, I don't know the date.
Do you think it's some people might say that it might have been a bit of a waste of the RAT tests if they haven't produced any positives? What's your response to that?
Look, I think with any trial, you do need to test the water and see what the go is. I don't think it is ever a waste. I think, as I said to you earlier, that it has produced confidence for the parents and the teachers for the children to attend the schools and the teachers to attend the schools. And I think that's really important to enable the schools to function. So it has served a very positive purpose for that.
Up in Wagga, we're seeing a fair bit of transmission in schools like we were here a couple of weeks ago. I mean, what would your reminder to young people be if, they're eligible for vaccination and they haven't got one yet?
Yeah, look, anyone over the age of 12 or 12 and over can get vaccinated, and I encourage them to get vaccinated, to their parents to get the kids to the vaccination clinics. It is our way out, and the more children, and the epi data really highlights the fact that young children are catching it because they're not vaccinated, and so we expect the younger cohorts potentially to be able to be vaccinated next year, but the 12-year-olds and up now, please get vaccinated while you can before you catch the virus.
Are vaccination rates kind of, or the rate, the speed at which people are getting vaccinated, is that slowing down at all? Because I would imagine by now most people who were going to get the vaccine at all would have already gotten it. Is that something that you're seeing? Are they slowing down and kind of, I mean, especially in the older age groups, not necessarily the younger ones?
Yeah, look, we are seeing a slowing of the vaccination uptake, and that always happens when you roll out a program. The people who can access vaccines easily will do so initially, early on, and then some of the people who have more difficulty accessing vaccines or require more convincing to be vaccinated, that those things take time. So yes, it is slowing a bit, but we're still offering lots of vaccine and opportunities for people to be vaccinated.
Are you hoping that the programs, vaccines, rapid antigen testing that you've got in place will be enough to prevent or make it slightly less bad if we have another outbreak in the schools when we're expecting that second peak in a couple of weeks?
Yeah, look, it's all the strategies in the toolbox that we use to try and sorry, I meant to catch that for you too. So all the tools, all the strategies in our toolbox we will use to minimise an impact of an outbreak. So it is rat testing, it is isolation, it is education, it is all those things that we can do to improve the outcome. We will continue to use those. And I see Lucy's here too.
Just quickly on the back of that, has your modelling changed? Are you still expecting a peak in a couple of weeks' time, or is that still?
Look, I think the modelling has indicated that we were likely to see an outbreak in Wagga, and that's probably the next thing. So it just depends. The thing with modelling is it depends on the factors that are put into the modelling that occurs. So the model is set on a certain vaccination rate and certain travel patterns and so forth. If those change, then obviously the outcomes and what occurs will change. And so, we do expect to see an increase in cases in Wagga and the rest of the district as well as we go forward. But we'll see how that goes.
And I have a couple of questions from Wagga, sorry. If a COVID positive case visits a location, will it still show in Service New South Wales history for anyone who attended the venue on the same day?
Yes, so Service New South Wales is now not only putting on their history section of the app that a venue is a case where a case is attended. They're now sending push messages to people who have also checked in with a more specific time frame as well. So if a person checked in at the time frame the case was there, they will get a push message to say monitor for symptoms. This Service New South Wales message does not mean that you need to isolate. It does not mean you're a close contact or a casual contact. What it does ask you to do is monitor for symptoms. And if you get symptoms, please get tested straight away.
And since the exposure sites will not be published on the New South Wales Health website, how are those who don't have access to the Service New South Wales app going to get that information?
Yeah, so they won't. That is a tool that's been utilised for the bulk of the population. For people who don't, if they identified as close contacts, however, because they will sign into the venues, so a risk assessment will be done on most venues, most of the higher risk venues anyway. And if those people who checked in were considered a close contact at risk, then we have their details and we would contact close contacts.
And the messaging has been has seen this shift to prevent businesses from copying the brunt of people, seeing them registered on the New South Wales list and being avoiding them. But how is this to be effective if the venues are still posted on Service New South Wales?
Could you ask that question again, please?
Yeah, so people have seen those exposure sites listed on the New South Wales Health website. They're getting publicised. People are avoiding those businesses. Those businesses are being financially impacted. But if people can still see the venues listed on the Service New South Wales app, then won't they still be financially impacted because people will still see them?
Well, people who will see the venues on the Service New South Wales app are people who attended those venues. So there is a slight difference in that. Look, those businesses may be affected, but realistically in today's world, every business is likely to have had an exposure over a period of time. And, I'm not sure that will have a financial or an impact on them in terms of operational in ongoing way.
Thank you.
Thank you.
Thank you.
Lucy.